The mission of the Technology Modernization Subcommittee is to make sure that VA is buying, using, and developing the right information technology in order to deliver the best care and services for our veterans. And that's the task that we have on this subcommittee, and it plays into why we are here today. Technology plays a huge role in delivering VA care to rural veterans because VA simply cannot give veterans all the care and services they need at traditional brick and mortar facilities that are often too far for veterans to reach or might not be as convenient to them because of their limitations for travel. This topic is also personal to me. I served 22 years in the United States Army, and I'm now building a family in a rural part of Michigan myself. I also represent Michigan State University in my district, so I do have to say a go green while I'm here. I know firsthand the frustration that veterans feel when the care they've earned is out of reach simply because of where they live. I actually do not have a VA hospital facility in the district that I represent, so the 800,000 or so residents of my district and the veterans there have to travel outside of my congressional district if they go to a VA hospital. That's what today is about, making sure rural veterans aren't left behind. The reality is, veterans in rural communities face serious barriers to accessing VA care. Nearly 1/3 of VA enrolled veterans live in rural communities. They drive longer distances. They wait longer for appointments, have fewer providers to choose from, and deal with limited broadband and transportation options. However, each community is different, and rural veterans do not all have the same experience with the VA. So I'm glad the ranking member and I were able to take our subcommittee on the road and talk to you all where you live and learn about the specific challenges that you face. In Washington, we hear a lot of experiences from people, but I think we all benefit from going directly to the source for where things are happening. And that's a good reason why we're here today. One of the most important tools that exists for rural veterans is the Community Care Program. Community care allows veterans, especially those in rural and underserved areas, to see outside providers when brick and mortar VA facilities can't meet their needs. Community care is VA care, and millions of veterans rely on it every single year. Having used community care personally, I know there is room for improvement. I want to ensure every veteran watching this hearing knows that they only need to meet one of the several criteria to qualify for community care. One is if the VA does not offer the service that is needed. Another is if the VA facility is not in the area in which they are located. If the VA cannot schedule an appointment quickly enough or close enough to them, or if community care is in the veteran's best medical interest. Under the leadership of Chairman Mike Bost, chairman of this committee, whose district is not too far south of here, this committee is working hard to ensure that rural veterans are able to make their own choice on whether community care is the right option for them if they are eligible. In addition to community care, VA has many other resources that are important for rural veterans, including telehealth, mobile medical units, and much more that we will hear about today. Technology has a big role to play here, and that is where this subcommittee comes in. There are a lot of exciting opportunities for technology to drive better VA care and services in rural communities. A great example is the external provider scheduling system, which allows VA staff to see real-time appointment availability and book directly with community providers or within the VA system, depending on which is available first and closer to home. While it is only active at around 50 VA medical centers currently, it has empowered staff to schedule up to 4 times more appointments per day by eliminating delays, confusion, and honestly a game of telephone that goes back and forth. Another great example is telemedicine. When it comes to mental health, where isolation is a real risk, tools like mental health and remote monitoring are essential lifelines for veterans who otherwise might fall through the cracks. And I want to say I'm very impressed by the services you have here that allow veterans to access those services around other veterans who may have had a shared experience to them. So I think that's another important community aspect of this. But even with these tools, there is room for improvement. Reports from GAO and the VA Inspector General have shown that rural health programs lack clear performance goals, outreach strategies that are inconsistent at the VISN level, and community care referrals still take too long, especially in high-need areas like mental health and women's care that we're still trying to make strides in. Provider participation in VA cellular networks is also lagging, with some rural providers walking away due to red tape, poor communication, or late payments. We can't let bureaucracy or outdated processes get in the way of quality and timely health care. This subcommittee is committed to ensuring that VA's rural health programs are well managed, accountable, and truly reaching the veterans they're meant to serve. That means cutting the red tape, improving access to care, and ensuring every veteran understands their options for quality care and that we leave no veteran behind to figure this out for themselves. It also means ensuring the resources are there to sustain proven services and tools, like the external provider scheduling system, telehealth, transportation services, and others. My goal is to ensure every program is driven by measurable outcomes that validates better health outcomes, not just good intentions. In fact, we talked about that today earlier. There are so many veteran organizations out there, each with good intentions, sometimes duplicating services, sometimes duplicating intentions, and having a real drive to find out where we can get that done in the best way is really important. The bottom line is this: geography should never be a barrier to care. If a veteran qualifies for VA health care, it's our job to make sure they can get it without delays, without confusion, without frustration, and without giving up. We hear too many stories about veterans who've simply abandoned the benefits that they've earned because they can't untangle the confusion. I look forward to hearing from you all about how we can accomplish this today. Before I turn it over to the ranking member, I just want to remind everyone here that this isn't an open forum, but is a oversight hearing for members of Congress and the witnesses that are before us today. They will be testifying under oath, so this isn't a forum for individuals to participate. But I know, seeing as how we're in the ranking member's district, if you do have questions of your own, I'm sure she's available to work with you on those. And with that, I will yield to the ranking member for her opening statement, and thank you again for having us.